welcome to the Your Food Matters podcast. I'm Dr. Sue Kleiner. I'm here with my friend, colleague, and partner in crime, Erik Bustillo.
Rock and roll.
Hey, hey. And we are going to talk to you today about something that really matters to us, which is how do you choose a coach or a guide or a nutrition expert or a personal trainer? What are the guidelines? How do you know who's the real deal and who may be just masquerading as an expert? If you enjoy this podcast, please tell your friends. You can find us on all kinds of platforms. We are hosted by the wonderful Move Nutrition Network. We are also on Spotify and Rumble and Apple Podcast and anywhere else, Erik?
I think we're on YouTube also.
Oh, yeah, we're on YouTube. That's where you can see us and listen to us at the same time. So please tell your friends if you enjoy this podcast. And we're just going to sort of chat away. So I'm going to let Erik get us started.
Awesome. Thank you so much, Sue. It's always good to be on here with you. This is a topic that I really enjoy talking about it because I like to think of people like yourself, myself, some of the people that maybe will refer other people to as like the crime fighters or the people who are fighting the good fight in the industry of science and evidence-based recommendations, nutrition and fitness and performance, sport nutrition, exercise science, everything that is involved in all of that. Because there is so much information out there. Notice I didn't say good nor bad information. There's all sorts of information, good, bad, right, wrong, just anything in between, really. We've certainly seen this almost explosion of information and people who are self-proclaimed experts or actual experts, especially in our field, or maybe I should say fields, right? Because we're more than maybe just dietitians from a science standpoint, from an exercise.
And you especially, you really are dual certified.
Yeah, on all the things, right? Which I find myself remembering or reminding myself, I should say, that I do wear multiple hats because as a dietitian, we're told to stay in your lane, which I think is important for all practitioners of anything from healthcare to fitness and all of that. If you're in banking, if you're in whatever it might be, and I sometimes forget that I'm also a well-versed individual or perhaps an expert in something like exercise and performance and all of that. But in our field, we know that there has always been the snake oil, right? The people, they're telling you what your problem is so that then they can sell that solution to you. And it's when the pandemic happened, everything that kind of came to light, I think, was not much of a surprise for people like us who have been around the fear mongering and the poor information, or the wrong information, I should say, because in nutrition that has been around for forever. But now, especially since the pandemic, it's everything. It's from fitness to, I used to joke around during the pandemic saying everyone is now an expert, not just in nutrition, but in, I don't know, political affairs, in finance,
in genetics, in immunology,
in virology, in real estate.
Right.
Like, I'm like, dude, you're going to talk to me about our immune system. And like, you weren't even in biology class in high school. Like, come on. But whatever. I guess people could always learn afterwards, and that's totally fine. Anyway, I digress. So being in the field, especially of of dietetics and nutrition, being a registered dietitian, we are oftentimes referred to as a nutritionist, as a nutritionalist, as a dietitian, as all these different titles and whatnot. But I think people don't know that there is a difference between being just, in air quotes, a nutritionist, and also being a registered dietitian or a registered dietitian nutritionist. So just to kind of go into that really quick, the difference is just about anyone, I shouldn't say just about, quite literally anyone can say that they are a nutritionist. There's no particular, I guess, governance on that, no governing body, no legalities or anything surrounding calling yourself a nutritionist. In order to be a registered dietitian, you go through schooling to become a registered dietitian. It used to be a bachelor's degree. Now, starting in 2024, it's a master's. So you have to have your master's. But once you finish with said degree, you have to get into a highly competitive internship. Just the way that medical doctors have to do their clinicals and different rotations and all of that, as a registered dietitian, we have to get accepted into this certified and supervised program where we learn from other dietitians. It's like the first steps of really getting our feet wet in the field or in the profession.
And in some universities, the people going toward their masters in nutrition, toward getting their registration degree or certification, they are taking the classes with the medical students. If they're at a
Most
school,
definitely.
yeah, if they're at a school that has a medical school, very often they're taking classes with the medical students, their clinical courses.
Yep, for sure. And I'm so glad that you said that, because I was completely forgetting about mentioning the fact that a lot of the time, and I remember in my undergrad, when I was doing my bachelor's, there were students who had zero intention of pursuing a registered dietitian route. They were looking to get into physical therapy, into becoming a physician assistant, or we're going to go on to medical school, like you just mentioned. The prerequisites, and a lot of times people don't know this, but a lot of our prerequisites are the same. So you have chemistry, Chem 1 and 2, you have biology, microbiology, organic chemistry, anatomy and physiology, and then it gets even deeper once you're in it, as far as like nutritional biochemistry, advanced nutrition or metabolism. The difference between some of the prereqs and for dietetics and nutrition and med school were very minimal differences. The big one that stands out to me was physics. I did not have to take physics, but I remember medical students had to take a physics class.
Mm-hmm.
I wasn't trying to take a physics class either, to be honest. So there's all of that, that background, that heavy science background. People call nutrition a soft science, and I think that we should probably stop calling it a soft science. It's a science, maybe newer than some others, but we can say it's a science. We're pretty confident and sure
Well,
about
I
that.
think I think within the sciences, because we do a lot of qualitative research as well as quantitative research, that's why it gets moved over into that, like you said, quote unquote, soft science. But that's more on the sort of food, cultural foods, understanding the anthropology of nutrition, sort of the heuristic approach to meaning what foods do people like, what they do not like, how do they feel when they eat certain foods. That's called a kind of heuristic approach, asking those kinds of questions. That's qualitative data and helps us develop, products for the food industry and all of that. But when we're talking about clinical nutrition, and this is where I think it's critically important for people to understand that if you're sick, A registered dietitian is, in all likelihood, the nutrition expert to help you. They have the training of understanding the medications, your disease issues, your comorbidities, or the complex of disease that you're facing and symptoms. They can communicate directly with your physician. There are nutritionists who are specialists in the area of psychiatry and psychology, working and understanding those medications and interactions. Really important to understand if you need clinical care, meaning medical, and you're not just and I don't want to demean weight management or sports or any of the rest. But this is really on the medical, clinical illness side. A registered dietitian really has the training to work with you.
For sure, most definitely. Especially on all things medical and those sorts of things. It's I think people oftentimes forget that we're trained in looking at blood work and those sorts of things, clinical and disease states. Medical nutrition therapy is probably one of the main things that dietitians are known for, right? So,
right. And then there's everything else.
Yeah, there's so many things, which, speaking about an internship, there's a lot that you go into in the internship. You have your community rotation, you have your clinical rotation, a food service management rotation. They've even started doing business or entrepreneurial side, or like an elective rotation.
Oh, wow.
Yeah, all these different things. So there's so much to the field of dietetics and nutrition. And one of the things that I tell students when I am their preceptor or their mentor, I want them to understand that it's important for us to stay in our lane when it comes to nutrition, but at the same time, don't be afraid to speak up for what you know and advocate for yourself and for the profession whenever needed and possible, right? Because there's a lot of misinformation out there, which we're kind of going to get into deciphering what makes someone a good practitioner or coach or anything like that.
Right. And the thing is, for the more general population that may not be looking for medical nutrition services, but are, as I said, more general wellness, health, prevention, weight management, maybe performance enhancement, there's never going to be enough registered dietitians, or even more specifically sports dietitians, to meet everybody's needs. And so one of the reasons we started the International Society of Sport Nutrition was we needed to know that we were sharing the critical information that we consider good basic nutrition information to our allied health professionals. So personal trainers, coaches, physical therapists, all kinds of people in the health professions who want to know and have it is part of their scope of practice to talk about basic good nutrition practices, to understand a little bit about supplements specific to the area that they're specializing in. And how can you just, chastise people for going out of their lane when everyone can't get to the highly specialized nutrition practitioner, but they can get to a personal trainer or someone who sees them on a weekly or semi-weekly basis. And so the whole point was, let's develop a certification where we really offer an education, an academic, science-based, evidence-based education to train those folks to share good information to their clients. And they are exposed to very high levels of science and come to our conferences. We have, all kinds of ways that they can continue their education. And so that was kind of the motivation for ISSN. And so today there are a host of people who can deliver good, healthy, basic nutrition advice, and that ideally know where their guideposts are. When your needs as a client go beyond the scope of their practice and knowledge.
Definitely. And I think something like a multidisciplinary approach for someone's overall care, be it healthcare or just their lifestyle goals, their performance, whatever it might be. But when we do have the team of a physical therapist, a strength coach and or personal trainer, a registered dietitian, like all these people working together, it just it's like things just flow greatly.
Oh,
And
yeah.
a good friend of mine, her name's Dr. Katie Dabrowski. She's going to be at ISSN this year. She's a physical therapist. We refer people, back and forth like crazy, and having that regular. I mean, we text almost on a daily basis, and we'll discuss, people that we're taking care of together, and it's so nice when it flows like
Right.
that, and that's how it
Right.
should be because I can give some exercise recommendations and she can give some nutrition recommendations, but we know that for the specifics, we're teaming up and doing this.
Right. And if you can get that teamwork, that's spectacular. Or if you can find, there's a certified sports dietitian that is also a registered dietitian. Or there are people like me. I mean, I have a PhD in nutrition and human performance, and I'm a registered dietitian. There's now, when we started, I was an N of one way back in the dark ages. But
The trailblazer, let's just say pioneer,
and and
throwing it
and
out
then
there.
slowly, then there was a group of us that were all practicing. Some were masters RDs, specializing in sports nutrition. Some more started to get, maybe they had their PhDs and they weren't RDs. Slowly there are more and more and more folks like us. So there is not one track to find the person. There are certainly sports medicine specialists who have extraordinary knowledge of nutrition, but seeking the people who have the credentialed knowledge, I think, is very important. And so, asking those questions: what are your credentials? What is your experience? And boy, experience isn't always a part of it because Erik and I have both been in positions where there's someone at a national level sports league being the nutrition expert who has no background and no business being where they are, but somebody knew somebody and they worked their way in there. And typically by the end of at least one season there, certainly two, everyone's figured out that this person is more harm than good and they're gone.
Yeah, most definitely. And that's oftentimes the way that things, I shouldn't say oftentimes, sometimes that's the way that things go. Um, it's, if someone is paying for a service, I find that it sometimes works out in a way where it's like, if you don't pay for the good quality care and the expert in a field, if you don't pay for them up front and you go for cheaper care, let's just say, for a cheaper coach, let's just say, um, you oftentimes end up paying more in the long run because someone who is well versed in taking care of someone um oftentimes has to undo the damage that was done by a not very qualified individual. So I say that because you made such an excellent point of people should ask those questions. What are your credentials? What was your schooling like? Are you a registered dietitian? Are you a certified personal trainer? Um, and also understanding like what experience do you have, and does this person have experience working with someone who is looking for what I want to accomplish? I think the experience piece is often forgotten. In Spanish, we say this thing. There's a saying. It's "El diablo sabe más por viejo que por diablo," which basically means the devil knows more because he's old, not because he's the devil. Um, the, so experience is an excellent teacher, um, but having those questions is important. Which also kind of brings me to the next point of um, using something like social media can be extremely important because people now, they're going to know the schooling of a registered dietitian, that in order to become a dietitian you have to complete those minimum 1,200 hours. In some cases it's even more, and then pass your board exam, and then continuing education, and all of that. But now, are they looking for the credentials? Are they looking for someone's perhaps even following on social media, and what kind of things do they post? Which leads me to the next point. What type of language do they use? Right? Because when someone speaks in absolutes, in the sense of you must avoid, this exercise, never do burpees because they suck, or they're the dumbest exercise, or never eat banana because whatever. I think when people speak in those black or whites, that should be a red flag of kind of like, there's, ideally we want to look for nuance, or an it depends in some way, shape, or form, as well as those credentials.
And there's certain things, I think, as you said, I kind of had, when I work and I teach with students, I have a list of things to watch for. I call them the quackery criteria. and,
I like
and
that.
number one is if someone's telling you you're broken and they can fix you, that's a red flag. None of us are broken. Our bodies are always working exactly the way they're designed to work. We may be screwing it up, and so the response is giving us a negative reaction, but the body is not broken. We just need to understand how to nurture and care for it. Number two is fear, and that's a big one, fear mongering. If someone's selling you fear, that whatever it is you should be afraid of, don't drink the water, it will kill you, buy my water filter, all those kinds of selling fear, which is probably 80% of what's on social media is selling fear. That's a quackery criteria. I never try and scare people into working with me. I am promoting health and wellness, and finding where they are, and understanding their goals and their expectations, and working with them. We partner to help get them to where they want to go. If anyone says to you, your family's going to tell you that you shouldn't be working with me, so don't share that don't tell anyone that you're working with me, because they're just going to try and influence you to not work with me. That's a quackery criteria, and that is rampant in certainly our field of nutrition and exercise, where the purveyor is saying to you that they're already telling you that people aren't going to trust them. So don't tell anyone that you're working with me. That's a dead giveaway. And so those kinds of things, and there's certainly more. And there's a cost to doing things that are not sort of in line with what we know, I guess. And that is that when you, especially on the medical nutrition therapy side, right? Let's say you have cancer, and someone says to you, well, I can give you this almond extract, and this is going to cure you. Don't go down that route of cancer treatment that's just going to be so uncomfortable, and it's going to hurt your body, and they're just trying to kill the cancer before they kill you. Don't follow what that oncologist says. I have this extract that will help you. Well, what you're choosing to do on a belief system is, you wish it would be true, and very often people will say, well, there's no harm in trying something that may not work for you, but it doesn't do anything else for you. Well, the harm is that your cancer has now progressed, and you have not treated it early on. And it may be so far along that it's pretty hard to now treat you to the point where, had you first done the sort of more classical line of treatment, that you would have been better off. Now, that doesn't say you can't do sort of a combination of things at the same time. And we know that, and much of medicine today talks about the importance of nutrition and exercise. That's not called alternative therapy. Complementary therapies like massage or even meditation, all of those are considered complementary. Don't go to those exclusively if you really do have a disease. And so that's really important, because always people say, well, what's the harm? Well, the harm is the lost opportunity.
For sure. Because that delaying in treatment in the case of something like cancer, that delay in treatment alone is certainly causing harm, perhaps directly or indirectly. So the language that people use should be a huge like deciphering tool for people. So we're looking at the credentials. We're looking at experience, either lived experience and or experience working with specific populations. The language that people use, we know, especially after what you said, fear sells. I don't know if more is the word or maybe better, but let's just feel fear sells better than hope does, right? Even though hope can sell, but fear is the better selling point if we can scare someone enough to do something. So I think using rational language like it depends, or an ongoing conversation, and not so much just like, hey, you have to do this. Human beings want that. We want the instant gratification, perhaps. We want the just tell me what to do and I'm going to do it, especially when we're scared. I think a good practitioner or professional is going to help someone feel more at ease. And what I like to tell patients and clients of mine is, you are the boss. I'm just here to help you figure out a way to make it work. It's very client or patient driven or centric, using empathy on my end, but I want them to feel comfortable expressing concerns to me. I want them to feel comfortable talking about things. The horror stories that I sometimes hear, and this is the other side of this coin, a doctor, let's just say, and I don't like picking on doctors, but they're the ones who are most known for this stuff. A doctor will tell patients or clients of mine something specific where they say they won't even listen to what the person is saying. They're not listening to the patient. They just want to say, this is what you have to do, this is what you have, without asking any questions. The person then feels not very good. Like I've had patients where the doctor walks in, looks at them, and says, "Oh, you're a candidate for bariatric surgery." No conversation before that, after that, just judging someone based on their body size, which is unfortunate. I've also had friends of mine see a doctor, didn't even look at my friend, and said, "Oh, your BMI is high. You definitely got to lose some weight." Not even looking at this person, seeing the amount of muscle mass that they had. Lean individual, good amount of muscle mass, but because they're a certain height and a certain weight, doctor said your BMI. So people have to be reminded that if your team or the professional that you're working with is not advocating for you and isn't answering the questions that you are asking, or at least even telling you, hey, I'm not 100% sure, let me look into it, let me find out for you. Having these rational conversations with you, that's also something important that people got to look out for.
100%, because humans are still human, right? And we're still fallible, and personalization in your care, whether it's nutrition, exercise, medical care, physical therapy, whatever it is, getting your hair cut, I mean, you want it done your way, and in a way that gives you satisfaction. And so if whatever professional you're working with isn't a good fit, that's just all it is. Keep looking. It doesn't mean that because it's a registered dietitian or because it's a certified exercise professional, because they have that they are the right person. But it's a good place to start.
For sure. Most definitely. And I think that's a good place to finish.
So, yeah, I just encourage everyone, be mindful as you are out there seeking guidance and help, coaching and other kinds of personal help, and 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 know that you matter. You matter, just like your food matters. So
For sure.
great to see you, Erik.
Likewise. And like I like to tell people, trust the process, be patient, and stay consistent, right? And now you have more tools to know how to kind of decipher between quackery and not so much quackery and all of that. So,
Perfect. All right,
yeah.
we'll see you soon.
Awesome.
Bye bye, everyone.
Bye, all.